Back problems are often one of the most common causes of poor performance and disobedience in horses. Yet, all too often they go undiagnosed and untreated, becoming first apparent when lameness occurs. Kissing spine, also referred to as dorsal spinous process impingement, DSPI, or Bastrup's disease, occurs when the dorsal spinous processes and or to a lesser extent the transverse spinous processes of the horse's vertebra start to rub together, causing pain and swelling, especially when active or being ridden. In addition to poor performance, other symptoms associated with kissing spine include resentment towards certain schooling exercises, difficulty in maintaining a 3-beat canter gait, irritability when a saddle is placed on the back and or the girth is tightened, and resentment of pressure grooming over the back. The standard approach to diagnosing kissing spine involves a gait analysis examination in combination with imaging procedures such as radiography and ultrasonography, allowing visualization of structures and lesions. In addition to imaging techniques, it is also possible to inject local anesthetics between the spinal processes where a kissing spine problem is suspected, and then to work the horse again to see if there is any improvement in performance. We have used the CURO system on a horse that had been diagnosed by a qualified veterinarian as having kissing spine in order to better understand muscle function at the various kissing spine sites along the horse's back. The CURO analysis measured during a period of trotting revealed that at site 1 and site 2, which correspond with thoracic vertebra T10 and T11, and lumbar vertebrae L3 and L4 respectively, there was a low level of muscle activity or tension as measured by the T frequency and S amplitude parameters of the acoustic myography signal, S and T being part of the ESTi-score adopted by the CURO system. In addition, the level of tension was very well balanced across the spine at these two sites. However, at site 2, thoracic vertebra T14 and T15, where the X-ray showed signs of kissing spine, there was a much higher level of muscle tension compared with either sites 1 or 4, and here a considerable imbalance when comparing the left-hand side with the right was noted. At site 3, thoracic vertebra T18 and lumbar vertebra L1, there was an elevated level of muscle tension which was more or less evenly balanced across the spine. It is impossible to say whether the imbalance in muscle tension measured during the CURO system gave rise to the spinal changes revealed using X-ray in this horse, or whether they simply represent a form of compensation arising from the discomfort and pain of the spinal changes. However, early detection of such muscle imbalances in the back region of horses using the CURO system could be a very rapid, non-invasive and valuable form of assessment in young horses under training. A form of assessment that could be used to investigate for signs of kissing spine at an early stage, where corrective training changes could be advantageous. Indeed, early detection of such muscle imbalances using the CURO system could be used to start a series of preventative corticosteroid injections applied around the potential kissing spine lesions, an approach that is often used by veterinarians in combination with prolonged rest and rehabilitation involving limited exercise and physiotherapy as a means of treatment.